So we know that in many of our trials, especially clinical trials that we're doing in smoldering myeloma, most of us will look at the cancer cell, at the genomics of the cancer cell, and ask the question, will that help us understand prognosis and response to therapy? But we're ignoring the other big part, the immune system, all of that ecosystem around the cancer cells. And we started to ask the question, well, if we do immune single cell sequencing of the bone marrow or of the peripheral blood, which is what we're showing now, can you identify biomarkers that can predict who will respond to therapy? Can you also decide which therapy, as we're now developing many immunotherapeutics, CAR T and many others, but also can you predict after they are in remission whether they will have this long progression-free survival afterwards? And interestingly, what we found is, yes, you can identify biomarkers early on before you start therapy of who will respond and who will not, but even better, we found that after therapy, we found that post-immunotherapy normalization, your immune system has normalized, that's a marker that you have this long-term remission and long progression-free survival. And hopefully that will be the immune MRD of multiple myeloma.